It's in the Hippocratic Oath. Physicians and surgeons swear to do no harm. That's likely why you chose the field you did, in order to help others. However, when surgeons aren't careful, they can accidentally do harm to patients who they had no intention to hurt. One example of this is with reconstructive surgeries on the disabled. It's important to first note the difference between reconstructive and cosmetic surgeries. According to the American Board of Cosmetic Surgeries, cosmetic surgery is entirely focused on enhancing a patient's appearance. Since cosmetic procedures treat areas that function properly, cosmetic surgery is designated as elective. On the other hand, according to Integrating Disability, Transforming Feminist Theory, cosmetic surgery's twin, reconstructive surgery, eliminates disability and enforces the ideas of what might be thought of as the normalcy system. Cosmetic surgery and reconstructive surgery are similar in that a lot of the time they are unnecessary. Unfortunately, however, both are pushed on patients more often than they should be in order to encourage patients to appear more normal. In the case of cosmetic surgery, according to Epistemologies of Bodies, if a woman chooses not to practice body work that emulates the dominant beauty standard, she may be subjected to the loss of social capital. The same is true for reconstructive surgeries. Every year, the American Society of Plastic Surgeons does a statistical report on what plastic surgeries were performed that year. In 2019, just under 6 million people in the United States got reconstructive surgery. 100,000 of those surgeries were breast reconstruction surgeries that are not typically necessary and are more cosmetic than they are reconstructive. And that's just one example. Other surgeries that are counted as reconstructive but are not medically necessary include scar removal and revision of birth defects, such as limb reconstruction or correcting a cleft palate. If surgeons were to stop pushing these surgeries, patients would likely be less likely to want them. Of course, physicians are also under a lot of pressure, but it's your training and your job to put your patient's best interests first. According to a study done by the National Center for Biotechnology Information, in 95% of cases where a patient is given either a prescription or referred to see a specialist, pressure from either the physician or the patient influences the physician's decision. As a physician, it's your job to make sure your patient is making the decision to have surgery for their own reasons, not reasons of fitting in that you may be unintentionally pushing. Thank you.